It's a pleasure to have Dr. Johnson back with us today. A lot of people, when they move to Memphis, or a lot of people who have lived in Memphis their whole lives, certainly complain about allergies because we seem to be ground zero for that problem. Dr. Johnson, could you tell us about this big, wordy term? What is allergic conjunctivitis?
It is a big word. Two big words, I guess. Well, you have in the white part of your eye, everybody knows about allergies, and so allergies are when we're exposed to something in our environment. It can be a food, it can be paint or clothing, it can be something in the air released from plants and trees budding out. And so when people have allergies, sometimes they have allergies in their body, okay, in which they have a lot of congestion or sneezing or just don't feel good. They may have itchy or watery eyes as well. And so when it comes to a patient coming in the office, they say, well, my eyes are really red and itchy and I've got allergies, and I've been taking something over the counter, an antihistamine, which is what releases that itchy effect, is the histamine in the blood. That an oral medication won't really take care of an itchy eyeball. So when they come in, then that's something that we have to treat with allergic prescribed drops. But allergic conjunctivitis is when the white part of our eyes that we see, we look in the mirror, the itis part means inflammation. It turns red and usually is watery, maybe itchy, maybe dry, maybe feel like something's in a person's eye. So I would just say that allergic conjunctivitis is something that we're all exposed to. There's a lot of allergists in the city. I hear this is the haven, as you said earlier. Not only, a haven, I guess, in the sense that there are more allergists in this city than any other because of the environment and the allergens that we're exposed to. So allergic conjunctivitis is quite common, especially in the fall and the spring. And we see a lot of patients that come in and say, hell, my eyes really hurt, water, itch, and what can I do? And a lot of times they'll say, well, I'll take allergy medicines, and say, well, that's fine for your overall allergies, but for your eyes you need something specific.
When it comes to contact lens wearers, are they at risk of experiencing additional discomfort because of allergies and especially pollen?
I would say yes, because the contact lenses, let's just assume that the lenses are soft. And in a soft lens, it's kind of a spongy material, has a water content to it, so the allergens floating around in the air, or if they then rub their eye, they've touched something they were allergic to, it's absorbed by that contact lens material. And when that happens, then that's in contact, no pun intended, the contacts are in contact with the actual eye and then transmit that inflammation or that exposure directly to an area of the eye that reacts to what's been absorbed in the contact lens. That's true whether it could be even contact lens solutions. It can be, like we're saying, pollen and things like that outside. But it's something that they would have touched, rubbed their eye, contact lenses then absorb that, and then that stays in their eye. So it's like continued absorption, exposure, until they would discontinue wearing their contacts. And we have to do that with patients. Say, we're going to have to get you cleared up first before we can let you wear contacts again.
Dr. Johnson, it's very important for patients to pay attention to their eye symptoms. But how would a patient be able to distinguish perhaps between what might be caused by an allergy, what might be caused by dry eye, and what might be caused by an infection?
That's a great question, because most people refer to all of that as I have a pink eye. And people will call up on the phone and say, I've got a pink eye, can't you call something in for me? And what they don't realize is you've mentioned 3 of the 5 reasons an eye could be red or pink. And so they can be exposed to like a fungus, they can be exposed to a virus, They can be exposed to allergy. They can be exposed to dryness. They can be exposed to an eye infection that is bacterial. Those are the 5 areas. And so I guess to answer your question, how would someone differentiate? They really need to come in and be seen, and then we could eliminate the serious things. The serious things might need an antiviral prescription, antifungal prescription, an antibiotic prescription, whether it be oral and or a drop that they would use. And if it's allergic, we would use, depends on the severity of the allergic reaction that they're having in their eyes, different types of medications to reduce the inflammation and to just calm down the eye. And calming down the eye then makes the blood not quite, I don't want to use the word intense, it doesn't flow as profusely. And so then the vessels, then we were trying to get them to get a little bit smaller, because when they get really red, that means it's pumping a lot of blood, a lot of histamine, assuming that it's an allergy. In the white part, the white, there's very thin, clear film over the white part of our eyes. That's the conjunctiva, and that's where the word conjunctivitis comes from, inflammation from that tissue. And when it's allergic, we treat with medication. And if it's dry, we treat with a different medication. But having similar symptoms, as also you said, if something got in their eye, they might feel like that they had a rock in their eye or a piece of something in their eye, when actually it could be that their eyes are so dry that then also creates a foreign body sensation, and so can an allergic reaction in terms of eyes can also feel like something's in the eye. So it's confusing. So people kind of blanket call all of these things pink eye, but I know today we're speaking specifically about allergic eyes, and you really can't tell, so you really have to be seen. Don't take that chance that it's just nothing. When you think, oh, it's just allergy season, it could be something that you've been exposed to that's serious and could be sight-threatening.
Dr. Johnson, I know in a previous interview we were talking about proper eyewear. Would proper eyewear have anything to do with maybe being able to deal with eye allergies a little bit better?
It's interesting you asked that too. There are different types of metals that people are allergic to. So we would try to use different metals that we would have in different frames that are hypoallergenic. Some people are allergic to the plastics, and some people are allergic to nickel. A lot of frames are made of nickel because it's kind of a more substantive material that holds up to wear and tear, so to speak. And then many of those are covered with titanium, and that helps, makes it lighter, but it also makes it less of a material or metal that could cause people to have an allergy. But that really wouldn't cause their eyes to be allergic. They'd usually get, allergic reaction around their face, around their eyes, around their nose, wherever the temples or the frames or the nose portion of the frame would come in contact with the skin.
Dr. Johnson, we certainly talk about this in every interview, but it certainly bears repeating. Why is it so very important to see an eye doctor every year? Because
it's so many things going on now. There are 3 million people a year in this country that have glaucoma, and even young people can have it, even if there's not someone else in the family that's not had it, and people may assume because that's the case that they don't need to worry about it if they still see fine. Assuming that you see fine means that your eyes are healthy is like saying I don't need to brush my teeth until they hurt. We can slowly be losing our vision, so we do a lot of digital imaging to see the areas of the back of the eye from which glasses or people who don't need glasses are working, and see if there's a problem with the health of the blood vessels that actually feed that area of the eye from which you can see. And so that's why we need to watch from an eye health standpoint, even if there's no need for a prescription change, even if there's no need for any prescription at all, no matter what the age, we start examining as young as 18 months of age. So people's vision changes, but it may have nothing to do with the need for changing glasses. It may have something to do with something sight-threatening that could be something going on in their bodies, as I think, like you said in other conversations we've had on your program, could be related to undiagnosed diabetes or blood pressure or some immunological type of disorder that they may not know that they have, or they may know that they do have. Anything from lupus or rheumatoid arthritis, there's a whole lot of things that can affect your central vision. The biggest thing, I guess, that a lot of people can relate to right now is that with all of our electronic devices that all of us are using, and especially young kids that are growing up from the time they're just little toddlers, playing on a phone, all of our electronic devices emit, whether it's an iPad or it's a phone, a desktop computer, a laptop computer, a Kindle, even overhead fluorescent lighting, they emit the blue wavelength of light. And so that is not something that we see when we look around in a room or outdoors, but that is the wavelength that's emitted from these devices. And that is the most damaging. It goes the furthest back into our eye, and it's totally concentrated in these devices. So that potentially sets people up for macular disease. The projection is in the next 20 years that 15 million people in this country will lose their vision to macular degeneration, precipitated in many cases by use of these electronic devices. So what we have done, you mentioned glasses earlier, we have now a piece of equipment, it's a new piece of technology that we use, and we screen for at-risk levels for someone who may be likely to lose their vision due to a thin pigment in the macular region, macular degeneration. They could go on to cause macular degeneration and use certain types of lenses that block or filter the blue light when they're looking with their glasses. And even if they don't wear glasses, it's important that they know that they may need some form of a lens to wear when they are on a computer, even if it may not have a correction in it. But that's something that has to be made. That's not something that you can pick up.
Dr. Johnson, can you talk about the free vision screenings offered by Eyewear Gallery, and also provide the contact information for Eyewear Gallery, and where is it physically located?
Okay, well, we're always glad to do the vision screenings. We do that on Fridays from 2 to 4 every week, all year round, and that can be in the form of someone wanting us just to see how well they see and check their eye pressures. It's kind of a baseline. And then if somebody wants to see if maybe their macular pigment is deficient, because we've just spoken about all the electronic devices, and I don't think there's any of us that don't use something like that. And we would screen them with the meter that we have that they look through, and it kind of has a flashing type of light that we can determine whether or not the pigment's healthy. So those are the types of screenings that we can do. We are located on Poplar Perkins Extended, actually on Perkins Extended, and our website is www.eyewear, EYEWEAR, gallery, GALLERY.com, and we're open 7 days a week, and our phone number is 763-2020.
Thank you so much. We've been speaking with Dr. Warren Johnson. One spells that first name Warren. He is a medical optometrist at Eyewear Gallery here in Memphis. This is Eye on Vision.